Welcome to Mind Your Mental Health channel, a channel for mental health awareness, psychological health, and well-being. We have done so far 21 episodes discussing about various aspects of the mental health and mental illnesses also. In the past 3 or 4 episodes, we were talking about mental illnesses or mental disorder. And we discuss about what is normal anxiety, abnormal anxiety, when do we call an anxiety as an abnormal and the disorder. And last episode we talked about generalized anxiety disorder. It is one of the anxiety disorders. There are a number of anxiety disorders. Generalized anxiety disorder is one, panic disorder is another one, then we have a phobic disorder, then we have PTSD, post-traumatic stress disorder. There are a number of anxiety related disorders. In this episode, 22nd episode, we are going to talk about panic disorder. Panic disorder, how common is panic disorder? And some of the research indicate that about 1% of the population could be suffering from panic disorder. And it is more common among women than men. And the age of onset, the age in which the panic disorder starts is around 25th year of age, 25th to 45th year of age. We have also seen panic disorder in much younger group. We have also seen panic disorder in children. Panic disorder in children is very rare. Most commonly we see around the age of 25 years to 45 years and then goes on. And 20% of the people who have panic disorder can also have another anxiety related disorder. For example, they can have a generalized anxiety disorder with panic disorder. And many a times we have noticed there is a history, family history of panic disorder. Suppose a patient comes to me with panic disorder. If I ask a question, is there anybody else in your family suffer from mental illness, and try to find out what kind of mental illness they suffer, and they might come out with a history that, oh, my father was having panic attacks or my mother was having panic attacks. So there is a possibility that 25% of the persons suffering from panic disorder could have a positive family history of panic disorder. So the indication is it can run in families. How does it present? What symptoms we have? So panic disorder is a discrete episodes of anxiety symptoms. It starts, peaks and ends. It's sudden in onset, doesn't give you warning. We might be anywhere now, in a shopping center, on a movie theater, or in a friend's house, or having a meal. So it can come anytime and it can come unpredictably. So it is a sudden onset of anxiety symptoms, not related to what you are doing, not precipitated by any particular event. It is unpredictable. You can't predict this is the time I'm going to get a panic attack. So it just comes on suddenly. That's what makes it more anxious now. So, and the sudden nature of the disorder and the kind of a concern it raises, kind of a discomfort it raises, can lead to anxious expectation or fear that I might get it any time. I might start planning to go for a shopping or go to a movie, and suddenly my mind will tell me, what happens if you get a panic attack in the middle of the movie? That kind of fear can happen in people, and they can even avoid going out, thinking that I might get a panic attack. Now, in between these attacks, they are completely symptom free. So these attacks are discrete episodes. They comes on and peaks and then comes down and stops. And then after that they are completely normal. They may not have any anxiety symptom till they get the next attack. So they are discrete attack. That's why it's called panic attack. And this disorder is called panic disorder. So sudden onset of an anxiety symptom, lasting for a short period and then completely resolving, is a panic disorder. And a person can have panic disorder once a month, once a week, Now the frequency varies. Sometimes the person can have several attacks in a day in a severe form of panic disorder. So it is unpredictable. The frequency could be varying. So some people come to us with once a month panic attack, or a lady might come to me with panic attacks every day. Now 2 or 3 panic attacks, and she wouldn't know when it's going to come, when it's going to stop. So that is the nature of the disorder. And it may not be related to an event. It is not necessary that something anxiety provoking event should happen. So an accident or something dastardly happen, then you develop anxiety. That is different. That is not panic disorder. Panic disorder comes without any kind of forewarning, without any reason. And what are the signs and symptoms of the disorder? These disorders predominantly present with anxiety symptom. Now naturally we are talking about anxiety disorders. Now we can divide these symptoms into bodily symptoms and psychological symptoms. There are a number of bodily symptoms, bodily changes or bodily symptoms, and number of psychological symptoms. Let me discuss about bodily symptoms. So these are due to several factors. Important one is certain hyperactivity of nervous system. Now there is a particular nervous system called autonomous nervous system, which I would have discussed about when we talked about fundamentals of mind. Now what is mind, how does it work, all those things. On those episodes I would have discussed about this autonomic nervous system. So when this system gets hyperactive, that can lead to some symptom. The symptoms are palpitation, or heartbeat goes higher and higher. They feel the heart beats faster, accelerated heartbeat, palpitation. So heart always beats. Now every minute we have about 70 to 80 beats, heartbeats now, and we are not aware of that. When we call palpitation, when you become aware of the heartbeat. Now we have been living for so long, I'm not aware of the heartbeat unless certain situation, some anxiety or some problem, health problem can induce higher heart rate, and then that becomes perceivable by the person. So palpitation, perception of higher heart rate, heartbeat, and sweating. They can profusely sweat, and because of the fear, because of the anxiety symptom. And they can have tremors, trembling, or whole body can be shaky. So they'll have a tremulousness, what we call as a tremulousness, or tremors. It can be fine tremors or whole body trembling with fear. And they can also have chest and abdomen related symptoms. Chest symptoms are breathlessness. They feel as if they are breathing harder and harder. And they can also have a choking sensation. They feel something is choking them. They are not able to breathe. Now they feel that I'm going to die because I'm not able to breathe. My heart is beating faster. That kind of a thought process will come. And the feeling of choking can lead to immediate seeking of some help. Now immediately they want something. And it can also be accompanied by chest pain or chest discomfort. This may not be due to the heart. This pain is perceived not because the heart is malfunctioning, it is because of the fear. That panic attack brings on this chest discomfort and chest pain. And they can also feel nauseating feeling. They feel like that they're going to become sick, they're going to throw up. And they can have abdominal distress, what we call butterflies in the stomach. Some kind of a discomfort in the epigastric region or in the stomach region. They have all these bodily symptoms. And in addition to that, they can also have psychological symptoms. Psychological symptoms are intense fear, apprehension that I'm going to die, apprehension that something needs to happen immediately. So the symptoms are so intense, they start and peaks. And at the peak of the symptom, they feel they're going to die. They feel they need to immediately go to the hospital, get admitted, get treated. They might go to the casualty with intense fear. They're telling the doctor, I'm going to die, doctor. I feel like this. My heart beats faster. Now I feel like I'm choking. All these things lead to intense fear, and that is one of the psychological symptoms. And another psychological symptom is that they might feel that I'm going to lose control over myself. I'm so restless, anxious, and then I don't know what to do. I'm choking. I'm breathing faster. I'm becoming breathlessness. I'm going to lose control over myself. I might go crazy, I might go mad. So this kind of a psychological thought, symptoms might surface. In addition to that, they can have hyperventilation. They might start breathing harder. They have hyperventilation. Then they'll have hot flushes and cold chills. Like they feel the whole body is getting warm. Hot feeling might come. They might start in one place and spread to the whole of the body. Or whole body can become chill, clammy, cold. This is another symptom of panic disorder. And they can have numbness. They feel that all limbs and hands are becoming numb. Or they can also have a tingling sensation in the extremities, especially in the legs or in the hands. Trembling and tingling sensations. All these symptoms are indicative of panic disorder. They come on suddenly and peak and then gradually come down and stop completely. These symptoms can be part of other disorders also. Generalized anxiety disorder, we have seen almost all these symptoms. If you go to phobic disorder, they also have the same symptom. The difference between these disorders is generalized anxiety disorder, the anxiety symptoms are generally there all the time. They wake up with a symptom, go to bed with a symptom. In panic disorder, symptom comes on suddenly, peaks, unbearable, they'll have to do something about it, and then comes down and disappears completely. Next attack might come after a month or a week. In between these two attacks, they can remain absolutely normal. But lingering fear will be there. When am I going to get another attack? I don't know when I'm going to get. I can't say I'll get it only when I go out. So that is a fear they have. So that's why it is very disabling condition when the attacks come. They can't do anything. Suppose I'm a doctor, I'm working, I'm seeing a patient. I need to see a patient, usually we spend about an hour in assessment or more than an hour. Suddenly in half an hour into the assessment, I'm just talking, suddenly get a panic attack. What happened? I can't function. I can't carry on my work. So that is a disabling. That's how it affects the social function or your professional function. So it can be a quite disabling disorder, especially when it comes more frequently. So we need to differentiate between panic disorder and panic attack. Panic attack, what we mean is the symptoms. The palpitation, the breathlessness, choking sensation, tremors, these are the symptoms. They can come suddenly, and when we say attack, it can be part of disorder or it can be part of other problem. Suppose I go through a very anxiety-provoking situation, I'll get all these symptoms and peaking. That could be a panic attack or panic symptom. When we are talking about a panic disorder, we are talking about discrete episode, onset, peak, and then come down, and then normality. And usually, each panic attack or panic disorder episode lasts for minutes only, not hours or days. Usually, the average, they last about 5 to 10 minutes. But in that 5 to 10 minutes, they go through immense suffering because they feel they're going to die. So that kind of fear they have. So panic disorder is slightly different from panic attacks. But we also need to remember or realize that some of the physical health problem can present with anxiety symptom, almost like panic disorder symptom. That's why we also look into the physical causes. Is there any physical disorder mimicking panic disorder? Common one is angina, that is related to the heart. You get an intense pain, chest pain. And asthma, sometimes asthma attack can present with anxiety symptom. And there are a number of other disorders. So mitral valve prolapse, this is another condition. It's a heart-related condition. They can present only with anxiety. So that's why usually when we assess, we also try to find out is there any organic cause or physical illness presenting as a panic disorder. Okay, what are the causes? Next logical question is, what causes this, doctor? In psychiatry, in mental health, there is no single factor. That's why we call it as multifactorial or biopsychosocial reasons for developing a disorder. Bio means bodily reasons, biological reason, psychological means psychological, and social means social reason. It could be anything, social tension, poverty, economic crisis, or the relationship problem, it could be anything. All these combined together can produce a mental disorder. In panic disorder, Some of the common reasons or causes are, one is neurotransmitters. As I discussed in previous episode, neurotransmitters are basic chemicals which is required in our day-to-day neurological functioning. Many other functioning. These neurotransmitters can go up and down. When it becomes abnormally low or high, that can lead to problems. So anxiety disorder also, there are certain neurotransmitters which can cause panic disorder. To name a few, GABA is one neurotransmitter, serotonin, you might have heard about it, cortisol. These are some of the neurotransmitters, hormones, chemicals that can cause panic disorder. And certain parts of the brain, for example, limbic system, certain part of the limbic system, there is a part of the brain called limbic system. Some of the parts of the limbic system can be hyperexcitable, so they overact, then can produce anxiety symptoms or panic disorder. Psychologically, one of the finding is a child going through adverse environment or adverse experiences in the childhood can develop panic disorder later on. So childhood experiences, traumas or adverse experiences can lead to panic symptom in a later life. And as I said, as I observed earlier, it can run in families. That means there is a genetic cause. Genes can contribute to the development of panic disorder. You need to be cautious here. When I say genes or it runs in family, it is not necessary that a father has a panic disorder, son or daughter should have it. A mother has it, daughter or son should have it. So what happens is, when a family member, a father or mother has a panic disorder, children can inherit propensity to develop panic disorder. Not necessarily they develop. They have the potency to develop a panic disorder. That depends on other factors, their bodily changes, the body function, their brain, all those things contribute to development, and social causes and psychological makeup. So it is not very simply father has, son should have it, nothing like that. So the mother has a panic disorder, daughter may not have it at all. So, but there is a chance of developing a panic disorder. So some of the research points out is, if one family member has a panic disorder, the first degree relatives has a 40% chance of developing a panic disorder. That is a research, that is a research finding. Okay, so we talked about causes of panic disorder. So we talked about what is panic disorder, where does it fit in the classification of panic disorder, anxiety disorder. And we talked about description of a panic disorder. Then we talked about signs and symptoms of a panic disorder. And we also talked about causes of panic disorder. So that leaves us with only one more topic, that is the treatment for panic disorder. There are a number of treatments available, and panic disorder can be treated by medications. There are a number of medications available. Usually avoid giving names of the medications in the channel, because it can lead to conflicts when somebody is kind of getting treated with particular medication that can kind of induce confusion in people. So that's why we avoid particular names of the medication. Generally, antidepressant belong in the SSRI group. There is a group of antidepressant called SSRI, and those antidepressants are usually prescribed for managing panic disorder. Benzodiazepines are prescribed very rarely. We don't usually prescribe because of the addiction potential for benzodiazepine. So we need to be very cautious about it. So main medication for panic disorder is antidepressant belonging to SSRI group. There are a few other medications available. Other than medication, we also advocate or suggest psychological therapies. Most importantly, a therapy called CBT, cognitive behavior therapy, is a very good therapy for panic disorder. And we can also give them some breathing techniques to manage their breathlessness, hyperventilation. There are techniques which we can teach them, they can learn. And we can also teach them some relaxation techniques so that they can relax, they can then calm down. And all these things are offered, either medication or combination of medication and psychological therapies are offered for panic disorder. And how many people respond? Nearly 80% of the people suffering from panic disorder do respond well to treatment. There are about 20% they may not respond that well. They might probably have ongoing or residual symptoms or ongoing symptoms. And about 60% of the people who suffer from panic disorder, when they take up the treatment, they take the medication and psychological therapies, about 60% of them can get well in 6 months' time, provided they follow the treatment. They follow the medication as prescribed, and they also engage well with psychological therapies. One important aspect of psychological therapy is it's a two-way communication, and patient has to engage in the therapy. Patient has to follow what the therapist tells them and understand what it is. If they haven't understood, they can ask them what it is and then follow what the therapist advise. If they do that, in about 60% of the patients, within 6 months, panic disorder can be managed. And a recurrence of symptoms are common. It is not uncommon. It is people can develop panic disorder again after a course of therapy. They can be normal for some time. Then the symptoms can resurface, and that can be managed again. So in this episode, we discuss about panic disorder, what it is, symptoms and causes and treatment. In the next episode, we will talk about phobia or phobic disorder. It's another disorder belonging to anxiety disorders group. We will discuss about it in the next episode. Thank you for being with us.